Plastic surgeons are giving women the chance to pump it up. Adjustable breast implants, making it possible to inflate or deflate your bust for at least 6 months after surgery. Procedure letting people change their minds. With us now, Dr. Jennifer Walden, a plastic surgeon. I guess the problem is sometimes when women get this done, they're not happy. They think they're too big or they're too small after the surgery.
Right, right. And one of the main goals that we have as plastic surgeons is to try to get it right the first time. And for most primary breast augmentation patients, we use implants that we don't adjust post-operatively. So we look at them and we have several discussions about size, the measurements of their chest, so we hope that we do not have to go in and do a second operation. But we do have available to us post-operative adjustable implants, and we usually use those on cases of breast asymmetry or women who've had problems with the development of one breast.
Right. How the heck does that work?
Well, basically it's an implant. There's two kinds. One is just a saline-filled implant with a silicone shell, and the other is a saline-filled implant with a silicone gel outer lumen. It has a tube connected to a port that is placed underneath the skin, and in the office, under a sterile technique, we inject saline into it after about 3 weeks from after the swelling goes down.
Okay, so it's not like a woman can say, gee, you know, I want them a little bit bigger today, and she can control. She has to go to the doctor.
Right, exactly. Okay. And it is a medical procedure. When they come to the doctor's office, they have to, you know, undergo a procedure. So it's not something that you would go to a salon and get done. Another thing to note is that we don't really necessarily want to be at the whims of if someone wants to be a little bit bigger for that Dior gown, or if someone feels bloated and they want to go down a little bit in size. So that's why we try to get it right and use implants in the first go-around that are not adjustable.
Do women go to you and say that? Like, I want to look bustier for a party and try to get things changed for something like that?
Well, they do. After the swelling goes down 6 months later, that's the most likely time that someone will be adjusted to their new body image. And they may, and the most common size adjustment they request is to go a little bit bigger.
Right. Now having that port in you, is that... I don't know, does that make you susceptible to infection, having something like that in your body?
And that's another reason why we wouldn't use that on every woman who has symmetric breasts that just wants to go bigger, because it's a port that's palpable. And one of our goals as plastic surgeons is to have a non-palpable, natural-looking breast augmentation. And so if you have that underneath the skin, it's palpable and it's susceptible to infections at the port side.
All right. Last quick question. Now, I guess they're allowing silicone implants. Again, does that change all this somehow?
Well, I think that it is a great thing that the FDA did approve silicone implants, because it allows us a more natural feel and a natural look to the breast. And so we don't necessarily have to worry as much about palpability, rippling, and the things that were kind of problems with the saline-filled breast implants. So I think that that helps too.
All right, Dr. Jennifer Walden, a plastic surgeon, thank you for coming in and talking with us. All right.